Oh, hello, everybody. That was just a sort of little introduction as to what we're going to look at today. And it's going to be Apis mellifica, the honeybee. This sends terror into some and joy into others. But we'll talk about that. This is a hive. Many of you probably know about honey and how it comes about. I envy all apirists because I so wish to be one. I think that bees are the most important to our environment, and I hope that they continue to be. The honeybee, it's both acute and chronic. Conditions can be solved with apis. It is, though, generally a acute remedy. So it is for those patients that ring up and ask about what can I do for this sting or this bite or this swelling potentially. And we'll talk about some of those significant symptoms shortly. So it doesn't mean that mental and emotional symptoms should not be considered, but it certainly is not the most prominent that you would look at if you were doing a hierarchy of symptoms when you were doing your repertorizing. When we look at it from a doctrine of signatures point of view, this means that how we connect it to the remedy to people and to the use of it. We look at behavioural and emotional aspects, and we all look at the physical attributes for it to be treated with. The symptom profile and the therapeutic indications of the bee is what we're going to talk about today. And as this is HOM 101, it's mainly acute that we're going to talk about. But when we talk about that in the hierarchy of symptoms, we're going to look at the peculiar, queer, rare, and strange. And the very first thing that we look at is what's called a brain cry, or alternatively, it's called cri encephalique. It's a shrill, piercing scream. Now, I'm sure you've all heard children scream, and it's quite piercing. This is something that would happen in children, but as well as adults. And it is where the brain is very affected, swollen, inflamed. There could be a brain or a head injury. There could be a brain bleed. There could potentially be high fevers and delirium, but you need to certainly refer these people. If you're hearing this and this is going on, then there's something more to it. So you certainly need to send these people to the emergency department because APIS is not going to cut it. You can give them an APIS remedy, but certainly make sure that they're going to the hospital. We look at, I've added in some rubrics here, and I know this is only HOM 101, but this is how we look at it in a repertory. We would have the symptom of delirium during a fever, but how we look it up in a repertory would be mind, delirium, fever during. And you can see that there are several there. You know, it talks about meningitis and encephalitis. It talks about delirious muttering. It talks about screaming, screeching, and pierced screams. Those pierced screams are like the worst. They're the sort of thing that make you go like this because it's just an awful, awful sound. It is a fearful sound as well. But this is how it would be written as a rubrics. Another strange, rare, queer, and peculiar, and again, I could be strange, rare, queer, and peculiar. Martin will agree, purely because I go SRQP, but it should be PQRS if we go alphabetically. But anyway, I won't deviate, even though I have. This is thirsty during a fever or a chill. Now, technically, generally, most times, APIS is thirstless. It is a thirstless remedy. People are not thirsty, except when they have a fever or a chill. So this is something to look for if potentially the person that is presenting has a fever. We can look at some mental and emotionals, but as I said before, they're mainly for when we're looking at chronic conditions. These people are very strong, very vital. They tend to be very active. And you would have heard the term busy like a bee. Now, these people tend to be on the go. They go, 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 go all the time. Now, when you're going all the time, you have a tendency to be clumsy. So they tend to bump into things. They tend to drop things with their hands. They tend to have bruises and bumps on them all the time because they're just this busy little bee that goes all over the place. And people wonder how they get things done. But they do, even though they're clumsy. There is a worker bee sort of mentality as well, where they have tasks to do. So one of the symptoms for apis is that they could, potentially look like they're a workaholic. They're very practical, they're very direct, they're very straightforward in how they speak. When they're answering questions, they won't answer them emotionally. They will answer them quite direct and quite straightforward. So you can sort of, think, well, okay, if this is what they're like in real life, then this is what their symptoms could potentially be looking at as well. But then they are also very family orientated. So there's that queen bee mentality. So the queen bee, she is in charge of the house. She is the one in control. They are very protective, they are very controlling, but because of that, they can also be quite jealous and suspicious because they're buzzing around going, well, what's going on? You'll do what I tell you because I'm the queen bee. And the person that they're trying to control or protect doesn't really quite know what's going on. But this is part of their demeanor, their personality, their behaviors, whether they be the little drone, the worker bee, or the queen bee. So you can sort of classify them in that regard. They tend to weep with a cause. So what they do is they will weep when there's something terrible to weep about. Otherwise, they don't. They can appear to be restless, nervous, fidgety. They can be easily quick to anger. So, much like a swarm of bees, I don't know if any of you have seen a swarm of bees, but you don't really want to get in their way because they can be quite irritable, quite excitable, and quite aggressive, especially when they have felt like they are betrayed or they are defending their family or they have been crossed in some way. Somebody has done them wrong. And so, therefore, they can get quite angry. And these outbursts can be full of rage. Their tone of voice will change immediately. You can see there, I talked about it briefly before, there's jealousy. Now, the jealousy, though, is very much a sort of female to female jealousy. So it could be that the husband comes home and talks about a co-worker and the wife can get a little pernickety and a little bit jealous and suspicious about what's going on. But you would need to do a differential diagnostics or compare it with lachesis or lachesis, depending on how you pronounce it, because it also is a jealous and suspicious remedy and also predominantly a female remedy. So it's interesting that that is also part of the symptoms. Children who are apis children tend to be hard to please. There are many, many remedies of children that are hard to please. Chamomilla could be one of them, pulsatilla could be one of them, yeah. And as you can see there, as I talked about before, there are people that love bees, but there are people that are fearful of bees. So there is a lot of fear symptoms in this particular remedy. Fears of death, fears of heart disease, fear of being alone, fear of being poisoned. So you can see there that there still are mental and emotional symptoms that they may talk about when they're presenting with an acute situation such as a bee sting. They may actually say, "Oh, I got stung by a bee and I think I'm going to die." That's the sort of thing that they would be considering. We then move on to some of the general things. Now, general symptoms are a little bit different. You will have learnt about it in Hom 101, but generals are things that are different sides, different thirst, different foods, different times, different weather patterns that the individual patient will present with. They prefer their symptoms get worse between 3 or 4, as you can see, and especially fevers and chills. And you might see it around about 4 o'clock that not only does their fever and their chill get worse, but all of a sudden they become thirsty because you can see there that there's thirstless and there's a whole heap of little asterisks. That means it's a predominant keynote symptom, which means that they are potentially thirstless all the time in just general life. You know, they may say, oh, yeah, I tried to drink enough water to get through the day, but I'm generally not a thirsty person. There are many, many thirstless remedies, pulsatilla being one of them. Apis patients also tend to be quite warm-blooded, so they prefer to be warm. They prefer they are hot and warm to touch. So when you touch their hand, they're not going to be cold and clammy. They're going to be more likely to be warm. They don't need to put on lots of clothes because they may say that I tend to be more hot than I am cold. This is a right-sided remedy, but it can move from right to left, which is important to note because there are similar ones. Again, lachesis is another one that tends to move from right to left, or it could be left to right. Sorry, I'll have to check that one with you. Worse at between 3 or 4, or worse at 3 or 4. So it could be anywhere in between those times, but it could be 3 p.m. or 4 p.m. where their symptoms tend to get worse. They're red-faced, but so too is belladonna, so you need to differentially diagnose. They do get hot flushes, but they may say to you that they feel like they might burst because it's all about swellings, swelling. If you think about a bee sting, what happens? It goes red, it puffs up, and it can become fluid retained and swollen. These are the modalities for Apis. So we're talking about worse for heat. So even though they're warm-blooded and tend to run warm, they don't like the heat. So they don't like hot drinks, they don't like a hot, stuffy room, and they certainly don't like having hot things placed on them, like a hot compress or a wheat bag or something like that. They don't like to be touched because, obviously, if you can feel that they're going to be swollen, who wants to be touched? It's like, your little brother or your little sister saying, does this bruise hurt? And they go, poke. So they don't like to be touched. There tends to be suppressed skin eruptions. So what might happen is they might get stung by the bee, but those skin, it might not erupt. It might not show up. They also tend to have a low libido. Before and during menses is also when the symptoms become worse. Things that they do like or things that they prefer or are better for are cold drinks, especially cold milk. If they say to you, I got stung by a bee and it's just not clearing up and I'm really, really swollen and all I seem to be craving is cold milk, then Apis would be one of the first that you would consider prescribing. Okay, they like cold applications, so a cold compress on the wound, cold compress on their heads, and they like cool air, so they might like to be fanned. Their symptoms become worse when they are jealous or enraged or vexated. So vexation is basically when they just don't feel that they're hard done by. Yeah, they don't like bad news and they don't like to be frightened. So any one of those can make their symptoms worse. So when you see those symbols, the two symbols of better for or worse for, it just means that it makes those symptoms are worse during those times. But you can see there that there is another little symbol, and that's desires. So these people desire company, a bit like the honeybee. It lives in a hive, and so therefore it has to be part of the community. And that part of the community means that they're always wanting to have company around them. Unlike someone like Nat Mur, who does not like company, or Sepia, who would prefer to detach from their family but have them in another room, just so that they're close by. Some of the very important physicals. So you can see here it's in red, and therefore it's important. And this is things that they're going to present with or things that you would prescribe for are going to be the following. So the following is stings and burns, insect stings, whether it be a bee, a mosquito, a wasp, a hornet. Most of the insects, even an ant, you could consider apis as your first to go-to remedy. It then would depend on whether there's a puncture, and then you might think of ledum, or if there's an allergic reaction, you might think of urtica urens. Um, so that's stinging nettle. So there's three main remedies there that we would use for stings. For burns, though, it's a little bit different. We would consider apis for superficial burns, not for really full-on burns or deep burns. But it can be used, you'd have to differentially diagnose with something like cantharis or even urtica urens again, and potentially hypericum, because all of those are burn remedies too. But it would always be red. So red is important here. The appearance of a wound is always important. The discoloration is always important. So here it is red. With something like ledum, it would be purple. So that just shows you the difference that you're looking at. And it's very swollen. It's going to appear swollen. It's going to look aflamed. And they're going to describe their pains. And again, there are many, many, many words for pain. It's going to be burning, it's going to be stinging, it's going to be pricking, because it's hot. It's from heat. It will feel hot when you touch it, if they allow you to touch it, but they will become irritated if you do touch it, a bit like a bee. If you go poking around a hive, hence the reason why they smoke them, to actually sort of make them more placid, is so that they don't go buzzing around your head and start stinging you. You can see there that there's swellings. They tend to retain fluid. And again, there's another, lots of asterisks. Whenever there's lots of asterisks, you can see that there is some importance to it. It is their face, their lips, their tongue, their throat, their airways. For those of you that have done AMP or that have done diseases or first aid courses, we're potentially looking at what could be an anaphylactic shock or an anaphylactic reaction. It is an allergic reaction remedy. Along with something like histamina, which is the histamine sarcode. So we need to be diligent when we're asking our patients questions when they ring up and go, well, I've been stung by something. So first of all, do you know what it's been stung by? Can you tell me where it is? What does it look like? Can you describe it to me? Can you tell me what the pain feels like? If you touch it, what does it feel like? They're the sorts of questions that you would be asking. There is certainly swelling of both the mucus and the serous membrane. So they're mouth to anus and nose area and your sort of eyes and all of those places where there is fluids and mucus and membranes. So it can affect the heart. It can affect anything that has sort of a membrane to it. So you need to be aware of that when you're thinking about it from a chronic perspective. Now, first aid. So these are the indicators. This is what we give it for. First aid, insect stings, primary allergic reactions. So it's the primary remedy for any allergic reaction. It is also known as the number one remedy for anaphylactic shock or anaphylaxis, especially when they start to become inflamed and swollen. But if it is anaphylaxis, they also need to go to the hospital, because no matter what apis you give them, it may mean that they need to have an adrenaline shot as well. So just be careful when prescribing first aid and acute, because it could be that there could be something more serious going on. Think about headaches when there's a swelling involved. It might be that it's a thumping sort of thing, and it could be that they have a tension headache, and so they're generally from a sitting on a computer for too long or focusing for too hard. There's itching and urticaria. Again, urticaria is hives. The common name for it is hives. And again, there's those three little asterisks, which means it's a primary remedy for hives, whether it be from a plant or whether it be from dust mites or pet dander or any of those sorts of things that they may have had an allergic reaction to. Again, you'd need to differentially diagnose with something like ledum or something like urtica urens, but it is one of the main ones for hives. There is edema, so there is going to be swelling, there is going to be fluid retention. It is both external and internal. So their feet, their ankles, their legs may puff up. So potentially it could be for a lymphedema, but again, you'd have to take their full case and look at it from a chronic perspective. Their throat can be swollen. So sore throats, it could be used for glands, here, the salivary glands, etc. Testes. It can be used for PCOS depending on the full symptom picture. But obviously, you're not going to prescribe that until you've taken a full case. It's not, PCOS is a chronic condition. And so therefore, you just need to, be aware that Apis may be one of those remedies that you are looking at. So, it is the remedy that will help with fluid balances. But there are other remedies that do help with that. Certainly some of the natrum tissue salt remedies also, like nat phos and nat sulf and sodium chloride or nat mur. All of those are to do with fluid balances as well. So you just need to be, this is where your differential diagnostics makes a big, big difference. Itises. So whenever we think itis, we think inflammation. And they are worse for inspiration. So breathing in, they have difficulty with. You might find that they cough on inspiration. It is used for kidney and urinary dysfunction, so cystitis and urine retention, especially in bubbers and infants. The brain, there is a dysfunction, and that brain dysfunction. So brain dysfunction, we had a little break because I had some interruptions, but the brain dysfunction that you are going to see, and again, you need to be very careful here as to how you prescribe and what advice you give, because if you're thinking it could be meningitis or hydrocephaly, you need to make sure that they go to the hospital for high fevers and headaches, depending on how long they've had them for and how long they last. But Apis is used for brain dysfunction. You connect it. Now, the way that you're going to connect this is to connect it to their mental symptoms. They might be absent-minded. They might appear confused. They might appear delirious. They might have some indifference, or they might have some apathy. So it just depends on where they're at mentally and emotionally as to what you're seeing as a brain dysfunction, okay? So you've just got to be very aware of that, because you don't want to be playing with someone's brain, especially when it comes to prescribing. The Apis patients tend to have a very high libido. Another remedy that has that sort of high libido is Cantharis, but Cantharis has a high libido, which is a strange, rare and peculiar, when they want to have sex. So they want to have sex when they're in pain. And that's a good, strange, rare and peculiar for Cantharis. But Apis tend to have a very high libido as well. So again, here are some more rubrics as to how you will see them in the repertory. So you could prescribe for acute cystitis, so UTI, where it says bladder inflammation cystitis. So it's an inflammation based on cystitis. There could be pain, burning, smarting of the bladder, retention of urine. Now, this is Apis is one of the primary ones for newborns that have retention of urine. Okay, so always think Apis when that happens in a newborn. All right, and just a simple, 12C or 12X, just on their pulse points, or even just, under their nose or just on their lips, is enough. That and aconite. The very first remedy that a newborn should be given is aconite, because it's a shock coming into a new world. But then, if there is urinary retention, you can think of apis. There is anuria, so there's no urination, and it's suppression of urine, so for the kidneys. Generals, again, kidneys is an important one for apis. So, there's swelling, there's edema, there's all sorts of things going on with the kidneys, okay? Now, this is what you are going to see. You are going to see, in a case of hives, it's either going to be large or small little bumps. They're going to be red, they could be white. They're certainly going to be itchy. They're going to burn or sting. So this is for hives. If you're looking at hives, they are going to be worse for warmth, and they're going to be better for cold applications, or worse for warm applications. And they're certainly going to be irritable when they've got hives. I don't know if you've experienced hives or you've known anybody who's experienced hives, but it's quite a nasty feeling. It's itchy. It can take over the whole chest. It can take over the whole torso. It can be up their arms, down their limbs, depending on how bad an outbreak they're going to have. But it's certainly not comfortable. Some of the remedies also that you need to look at for complementing or having after is Natmer. Now, Natmer tends to be the chronic of Apis. So Apis is the acute and Natmer is the chronic. They're both warm-blooded, and they're both hives that is worse for warmth, okay? You've then got to compare some of your remedies, all right? So when comparing the remedies, you'd look at, as we've talked about, ledum, urtica urens. Ledum is more for when there's long-term allergic reactions or long-term issues. Urtica urens, more for plant reactions than anything else. Pulsatilla you might look at, because again, they're quite weepy, and it's quite a female remedy. It's also a very prominent children's remedy. Belladonna, we've sort of talked about. It's got that red flushed face. It is on the same side, so it is right-sided. They are more affected at 3 p.m. But belladonna you would give more for a fever than you would for swelling. So if belladonna is hot and red and burning and feverish, you might think belladonna. If the symptoms are hot and red and swollen, that's when you think of apis, okay? Lycopodium, again, same times, same sides, all right? And cantharis, and we talked about that in terms of libido and burns, etc. So here's a little picture. So you can see it's for widows. They're jealous, they're weeping, they're nervous, they're sad, they're hard to please. They dislike interference. So again, there's that controlling aspect, that queen bee. Don't interfere with my family. This is my family and I'm in control. Yeah. There's that jealousy. There's that, female to female sort of jealousy. You can see that there's, a picture of a female and what looks like a female little bug coming after her. Some of the indicators, again, we talked about kidneys, ascites, that's the liver. Urticaria, we've talked about. Herpes zoster is more chickenpox. So again, if you think chickenpox or if you think herpes, it's blistering. Again, cantharis is one of the herpes remedies as well. Rus tox, not cantharis, is one of the herpes remedies as well, though. You can see the insect bites, chickenpox, mumps, UTIs, and influenza. So, key notes, we've talked about it. Swelling, edema, fluid retention, general and local. So they have, again, this is similar to Gelsenium. They have a baggy swelling. So under their eyes will look very baggy, very droopy. Okay, so there will be very swelling under the eyes, burning, stinging pains. Again, we've talked about that. They're very hypersensitive. They're not thirsty, right-sided. Hot, we've talked about, so worse for heat, better for cold, love milk, constricted feeling. So everything, obviously, because it's swollen, it's then going to feel very tight. Um, I'm sure some of the women that are listening to this will feel that on a very, very hot day, their feet might feel very, very tight after a very hot day, especially if they are perimenopausal or menopausal. So you could think apis to help bring that swelling down. Normally you would tell your patient to raise their legs above their heart to bring swelling down, but apis might be one of the remedies that you could look at, and you'd look at maybe a 30C or even a 200C, because it's only because they've been walking around all day, or they've been in a car all day, or traveling a lot, and they're feeling a bit swollen. Okay. Stretched, tight, worse for touch, worse for pressure. All right. And again, as I said, 30C or 200C, you could give it SOS, so you could give it as needed, or you could give it BD or TDS, 2 or 3 times a day. Modalities, we've talked about this. They're not good for warmth or hot weather. They're better for cool air. Again, we've talked about this. When we talk about chronic or complementary, so APIS is the acute, which we discussed, and NATMER is the chronic to APIS. Inimicable, though, do not give rust tox after you have given APIS. You can cause more harm. The symptoms can become worse because of it, and you can actually make your patient more ill than anything else. Okay, so just be aware of that. That's very important to know the relationships of your remedies, especially the inimicable remedies. Learn more with Switch on Health. I'm Sally. This is one of your remedies, which is APIS. Enjoy your day. Okay.